Folicure Hair Replacement Academy reports top medical conditions that can result in hair loss in men. Understanding the various conditions that can lead to hair loss is crucial for men's overall health and well-being. Hair loss is a common concern for men, impacting not only the way they look but also how they feel about themselves. While male pattern baldness is the most recognized reason for hair loss, it's not the only medical culprit. Understanding the various conditions that can lead to hair loss is crucial for men's overall health and well-being. This listicle breaks down some of the most prevalent medical conditions that could be at the root of your receding hairline. Medical conditions and hair loss. What you should know. Hair loss is a common concern, and its impact on self-esteem can be significant, especially for men. While some hair loss can be attributed to genetic predisposition, several medical conditions are also notorious for contributing to thinning hair or baldness. Understanding these conditions is the first step in addressing and potentially treating hair loss. Here's a look at some of the most common medical culprits. Alopecia areata. In the complex world of male hair loss, alopecia areata stands out as an autoimmune condition that leads to hair falling out in small, usually round patches. This condition can affect anyone, young or old, and while the hair often returns without treatment, it can also progress to total loss of hair on the scalp or even complete loss of body hair. Currently, there is no known cure, but treatments that might help control it include corticosteroid injections, ointments, or creams. Thyroid disorders. It's not just the thyroid impairing metabolism. Imbalanced levels of thyroid hormones can also lead to hair thinning. Hypothyroidism. The underactive thyroid state can result in hair loss across the entire scalp evenly and is among the more common conditions that can disrupt the hair growth cycle. Fortunately, medications to manage thyroid levels can often lead to the restoration of hair's natural thickness. Addison's disease. Addison's disease, also known as primary adrenal insufficiency, is a condition that affects the body's ability to produce sufficient levels of certain hormones, leading to a variety of symptoms, including hair loss. This chronic condition occurs when the adrenal glands do not produce enough steroid hormones, cortisol, and aldosterone. The decreased cortisol levels can contribute to thinning hair or even bald spots in some cases. Treatment for Addison's disease typically involves hormone replacement therapy and/or corticosteroid shots, which can help manage symptoms and potentially improve hair health. Scalp infections. Scalp infections such as ringworm can cause hair loss in both children and adults. These infections are usually treatable, and the hair loss is usually temporary. However, when treated later with the wrong medications, permanent hair loss can occur. This makes early detection and treatment critical for preventing long-term effects on hair health. Nutritional deficiencies. Your hair needs certain nutrients to grow and remain healthy. Deficiencies in key vitamins and minerals can have a noticeable impact on hair. Iron deficiency, for instance, is a well-known cause of hair loss in women, but it can also affect men. Similarly, low levels of vitamin D, vitamin B, and other nutrients can disrupt hair growth. In such cases, simply altering the diet to include more nutrient-rich foods or taking supplements can significantly aid in the restoration of healthy hair. Sudden weight loss. Rapid weight loss, whether due to extreme dieting, an illness, or certain medical conditions, can shock the body and lead to hair shedding. When the body is depleted of energy and essential nutrients from such rapid loss, vital organ functions are prioritized over non-essential ones like hair growth. Once the weight stabilizes and the body's condition improves, hair loss typically ceases and new strands begin to grow. Trichotillomania. Affecting between 0.5% and 2% of people in the United States, this psychological condition involves individuals compulsively pulling out their hair, often from the scalp but also from other body areas, leading to noticeable bald patches. Behavioral therapies such as exposure and response prevention, ERP, and medications can be effective treatments for trichotillomania, helping individuals manage the underlying thoughts and emotions that cause hair-pulling behaviors. Medications and medical treatments. Certain medications and medical treatments can also lead to hair loss. Chemotherapy, for example, is a well-known cause of hair loss, but other medications can also have this side effect. If you are concerned about hair loss and are taking medications, discuss your concerns with your healthcare provider. Treatment adjustments or a change to a different medication may be possible. Diagnosing and treating conditions. Hair loss can be a natural part of the aging process, but it can also be a symptom of a broad range of serious health conditions. So it is important to seek help from a medical professional if you notice sudden, unexplained hair loss. Diagnostic tests may include thyroid function tests, blood tests, or a biopsy of the scalp in some cases. Once the underlying condition is identified, treatments range from medications to manage thyroid disorders, to antifungal treatments for infections, to addressing nutritional imbalances with diet changes or supplements. Customized non-surgical hair replacement for irreversible hair loss. For many men, hair loss impacts not just their physical appearance, but their emotional and mental health as well. And you might be looking for a solution that can help restore your hair with minimal invasiveness. This is where customized non-surgical hair replacement comes into play. Highly realistic hair pieces, made from synthetic or real human hair, can be tailored to match your natural hair color, style, and growth patterns. Unlike traditional wigs, these pieces are strategically integrated with your existing hair, blending seamlessly and providing a natural, full look. A personalized hair replacement solution allows you to maintain your preferred aesthetic without the expense or recovery time of surgical options. About Folicure Hair Replacement Academy. At Folicure, we understand that baldness is more than just skin deep. Whether as a result of a health condition such as a thyroid dysfunction or a hormonal abnormality, a side effect of medical treatment such as chemotherapy, or simply a result of aging, hair loss can be anywhere from frustrating to devastating. Folicure Hair is the answer to preserving the hair you still have, stopping hair loss in its early stages, or recovering a full head of hair. We deliver results that cannot be achieved with invasive hair transplant surgeries or dangerous chemicals with documented adverse effects. Instead, Folicure will craft a comfortable, undetectable hair replacement system that's right for you. Schedule your free, no-obligation consultation today. https://www.folicurehairreplacementacademy.com/